here's the mindset of progressives. If we get the rich people and if we get healthy people to pay for the insurance and to pay for the healthcare that they're not using, that it's the sick, most likely poor people that are using most of, that they'll start going to the shitty hospitals, and the rich people will now force the hospitals to be better. What will most likely happen, which is what happened in communism, in any example that you can find, is that the rich people will still win because they'll bribe doctors. They'll find ways to pay for the better service. They're going to go to the best hospitals in the country. They're not going to go where the poor people go and effectively try to change it and make it better. What they're going to do is they're going to use the money they have to find ways to pay doctors who are going to want to take that money. This is not the dream healthcare system you want. This is a nightmare. I just don't know if fundamentally the government has any business being in healthcare, because it kind of seems that the more the government tries to do, they kind of sort of F it up a little bit more. Hey, what's up? Eric Levi here, the Holistic A-Hole. Thanks for tuning back into the channel. If you're new here, please take a moment and hit the subscribe button right below the video. And remember to smash that like button. So I'm a big fan of the Jimmy Dore Show. Jimmy had on his show recently Tulsi Gabbard, who of course is a Democratic candidate running for president. And for a long time, she was really kind of on board with the rest of these Democrats with this Medicare For All thing. But now she's kind of, getting off that a little bit and is kind of reformulating her thoughts on Medicare or on Medicare for All and healthcare. And when she was on Jimmy Dore, she was kind of going through, what her stance is.
There was a guy who came to a town hall in Iowa who talked about how he gets together with the same group of guys every single weekend for coffee and breakfast on a Sunday morning, and all of his friends voted for Trump. And all of his friends are supporting whether it's a Medicare for All or a single payer plus type program, because they're all very concerned about their health care and the ability to make sure that whether it's for themselves or their loved ones or their kids, some of whom may have pre-existing conditions or rare diseases, that they're not going to be able to afford the kinds of medicines and care that they need. So again, this is one of many issues where if you really expose the Washington attitude of self-serving politicians and the pay-to-play culture that big insurance and big pharma are contributing to, and actually just focus on how this is actually an issue that's bringing people together around one of the most basic essential needs that we have, then you see the opportunity to say, hey, healthcare should be about health care, not about a greedy for-profit driven system that actually ends up hurting people the most.
So what you seem to be supporting, and I just want to get clarity. I know your plan isn't out yet, but people are saying, oh, Tulsi flip-flopped on Medicare for All. Now, you seem to be not wanting to outlaw private insurance, more like, say, what works in Australia.
That's
so
right.
Now I'm very familiar. I've been to Australia. I know how their system works. And it seems everybody was really happy with their health care.
Yeah.
And they couldn't believe how we did it here in the United States. So that, to me, is 1,000% improvement. That certainly is still Medicare for All.
So Jimmy keeps bringing up this whole Australian healthcare system, and I think it's great how he says, hey, I've been to Australia and everybody seemed to love their healthcare. Like, what does that even mean, Jimmy? You know what I mean? Like, what do you mean everybody seems to love their health? Were you just talking to people about healthcare? You probably went to do comedy. Were you just sitting out there outside of the comedy club? Like, so you've been to the doctor recently? How's that experience? How's the healthcare going? It's a real good comedy club conversation. Not to mention, it's like, how can you even say like, oh, I talk to people and most people seem to like their healthcare? Who are these people? Who are these people you talk to who love their healthcare? Because it doesn't seem that most people love their healthcare. In fact, when you bring up the data, such as this, a review of the Australian healthcare system, a policy perspective, which was a review that was done about a year ago, published in the Sage Open Medical Journal, it kind of seems that most people don't like their healthcare. So if you actually look at the data, you can see it says right here, 48% of the public viewed the public health system as adequate, requiring only minor changes, and 43% saw a need for fundamental change. So not only did most people not like their current insurance, but almost half the people believe that the system needs a complete fundamental change. So it's good to understand what the Australian healthcare system even is. It's not really a Medicare for all, it's a hybrid system, okay? And you can see that right here. The Australian healthcare system is a hybrid model under which citizens, permanent residents, and refugees can buy private insurance coverage in addition to the public insurance they already have and gain access to both private and public hospitals. So this is in comparison to a welfare state model, which is really what Jimmy Dore wants. That's right here. A healthcare funded by tax dollars, and the government assumes full responsibility for the provisions of healthcare services. Then you have a market model, which is really what we have right now. Come on, let's blue that up. The choice and payment of healthcare services are left to the individual citizens and private institutions. And then the hybrid model. Progressives are very against this idea of there being, this kind of dual system where, you have a public system, which is what they want. They just want everybody to be covered by the government, and the government is the only person in the insurance game. And then in places like Australia, in the hybrid model, you can actually buy private insurance, which will cover you for, I guess, better service or expedited service. Because right now, the thing that people don't understand about Medicare for people 65 and older is that Medicare doesn't actually cover 100% of a person's medical expenses. In fact, Medicare covers up to about 90%, okay? And for some people, it might even be a little less. So most older folks have to purchase additional health care, okay? Many people have it through things like AARP. Some people have, employer-sponsored stuff, but most people will have to end up buying some kind of private insurance anyway. So even in a regular Medicare model as it currently is, nobody is covered 100% by the government, okay? And some people will make the argument that, well, this is what helps hospitals stay profitable. This is what helps doctors make money, because essentially what they can do is they can take those bills, they can jack them up, send them to the insurance company so that they'll get a little bit higher of a payment than they would if they just kept it at the Medicare allowable. So looking at this kind of idea of a hybrid system like you get in Australia, and again, I know Jimmy Dore doesn't like this, but, if this is what Tulsi wants, this is not a great thing, okay? Because what you start getting then is basically the government is saying, we're going to pay for everybody to have the most bare bones healthcare that we can afford, because the government is not going to pay for Cadillac healthcare. They're not going to pay for somebody's, multiple knee surgeries for a person, right? They're going to pay for a knee surgery. And then if you've got to get another one, they're going to be like, why do you need another one? Why do you need another knee surgery? And they might pay for your knee surgery, but they're not going to send you to the best knee surgeon. You're going to get the bottom of the barrel knee surgeon, the least price knee surgeon you can find. Probably the knee surgeon who just got out of knee surgery school. Or maybe the old crusty knee surgeon who has a few malpractice suits, but, because everybody now has insurance, we kind of sort of need more doctors to be around. So you're going to get the guy who might have a few, scars, to say the least, on his record. So to me, the big issue with an American Medicare for All system is really the unsustainability of it. Would it be great for everybody in the country to just be able to get sick or to have some kind of medical issue, whether it's pre-existing or not, and go down to the local doctor's office or go down to the hospital and get that issue taken care of by a professional, and then get patched up, get the care you need, and go on about your life? Yes, that would be ideal. But the problem is in America. Whether you like this or not, there are 320 million people that live in this country. I believe 327 million people that live in this country, okay? So when we're talking about an Australian model, for instance, in Australia, what you get is right here, okay? So as of June 2016, Australia's total population was 24 million people, okay? Now, in that time, there was not 322. There were 1,322 hospitals in Australia. Okay, so when you actually do the math, that comes out to one hospital for every 18,154 people. Now, according to the American Hospital Association, here in the U.S., we have 6,210 hospitals. That's the total amount of hospitals in the U.S., right? And then you split that between 327 million people. What you're getting is one hospital for 52,657 people. So in Australia, a system that is only favored by less than 50% of the people there, you have one hospital for a little over 18,000 people. In the US, you have one hospital for 3 times as many people. So either we need to build 3 times as many hospitals as we have now, or you just deal with the long wait times that is supposed to be a big Republican scare tactic talking point. Or it's just basic math. Now, it's also important to note the actual care that people are getting, right? The actual ability not just to see a doctor, but to get the services you need. So if you look here, right, Australian healthcare system's key issues and problems, Australia has the highest number of MRI machines, 13.4 per million people, but has the lowest MRI exams, only 27.6 per 1,000 people. Okay, so that is not a lot of exams, all things considered. But you look over here, according to the OECD data, you can see here 65 MRI exams per 1,000 inhabitants. So again, we're coming up to about 3 times as much care than the Australian people have. Okay, so what's my point with this? My point is, not only do we have way more people per hospital, but we also have way more people who need way more care per the population that we have. So, as we sit here and talk about, is this Medicare for All up against, if we put it up against the Australian model, how does it compare? Because the Australian model is not perfect, but it could be worked. It just doesn't fit. It just doesn't fit here in this country. The other thing is that Australia uses this activity-based funding system, which is a way of funding hospitals whereby the hospitals get paid for the numbers and mix of patients that they treat. So if a hospital treats more patients, they get more funding. So what's the problem with that? Well, on the other side of long wait times, now instead what you're going to get if you go that route, an activity-based funding system, is that you might get shorter wait times, but the hospital is actually being rewarded for seeing more people. So what's to stop a hospital from going and saying, well, normally a doctor would see a patient for 15 minutes. Let's cut that down to 5 minutes so we can crank more patients out of here and they get more funding. Remember, hospitals have to pay to keep the lights on. Hospitals have a lot of expensive equipment that they need to pay for. They also have expensive doctors they need to pay for, and doctors want to get paid too. So an activity-based funding model is very complicated, and for people here in the U.S. who do want quality care, this is the thing we forget. We want free care, and we also want quality care. Do you want free care if it's absolute garbage? In America, we need quality. We have Yelp reviews, and we talk a lot of shit. When you actually look at the numbers, it does not seem like the Australian model is really doing all that well. In fact, if you look here, what we have is the 2017 Public Hospital Report Card. You're looking at emergency department and waiting times. Again, this is the Public Hospital Report Card. Patients seen within clinically recommended times, right? Under the target agreed by all the Australian governments from 2012 to 2013, you're supposed to have 80% of emergency department presentations will be seen within clinically recommended triage times as recommended by the Australian College for Emergency Medicine. The reality is performance against this target is now heading in the opposite direction. Only 67% of the emergency department patients classified as urgent in 2015-2016 were seen within the recommended 30 minutes, okay? So that's a problem. If only 67%, that's a D. That's a failing grade by most American public school standards. Okay, only 67% of emergency room visits were seen within the recommended 30 minutes. And of course, if they're on this activity-based funding plan, yeah, that should be able to be done. It's financially in the best interest of a hospital to see a patient within that allotted amount of time. But even these hospitals are still not able. Even that's not enough of an incentive because they just cannot handle, most likely, all of the patients that are now coming into these emergency rooms. And remember, in Australia, they have 3 times less the amount of people per hospital. So if it's already a problem with that low number of people to hospital that they have in Australia, imagine how much worse it's going to be here in America. And when it comes to elective surgery, it's really no better. You're looking at elective surgery and waiting times evaluations, right? So you can look down here, the median waiting time, nationally, median waiting times for all elective surgeries have increased over the last 10 years. In 2015, 2016, the national median waiting time, the time in which 50% of all patients were admitted, increased to 37 days, the longest median waiting time reported since 2012, 2001, 2002. And you can see this graph right here, how the waiting times just have increased, pretty substantially. There's actually a hidden number within that wait time because, this is just the wait time from the time that you go see the specialist to the time you actually have the surgery. But what they're not adding into that is the fact that before you even go see a specialist, you have to go see a general practitioner who refers you to the specialist. So they're not adding in the wait time between the time you see the general practitioner to the time you see the specialist to the time you eventually get that surgery done. So if you need a surgery, and elective surgeries are, gallbladder removal, hysterectomies, knee surgeries, all still very important surgeries, and the longer you wait, the more it makes your life just a living hell. You're waiting over a month, possibly a couple months, possibly several months. This is not the dream healthcare system you want. This is a nightmare. If you have an emergency, if you have an elective surgery that is just the lack of it being done is making your life a living hell, waiting more than 30 days is tough. A month is a long time, but waiting several months can be an absolute nightmare.
In a nutshell, it is making sure that through a single payer plus plan, every single American would automatically be able to get the care that they need through this plan. If you also want to purchase a supplementary insurance plan, or you've got an employer-sponsored plan, or you have something else going on, you have the freedom to do so if you want. But that does not undermine or take away from every single person being able to get the quality care that every single American deserves.
But that's the problem, Tulsi, is they can't get the care they need. They need the care, but as we've seen, the wait times to get that care, either by a professional or by someone who might not be as qualified, which is a terrible situation to be in, that wait time is ridiculously long. So people aren't getting the care they need. If you get the care you need, that means you're getting it when you need it.
And everybody pays in. So
Yes.
nobody gets to opt out. So the way it works in Australia, and they call their system Medicare,
Right.
is everybody pays in.
That's right.
And so, but you can also then purchase, but when you pay in, you don't get to choose your doctor, but you get to choose your hospital. You get to go to a hospital, you get to get taken care of, but you might have to share a room, and you don't get to choose your doctor now.
And I love how Jimmy just kind of brushes that off, like, well, you get to choose the hospital, but you don't get to choose the doctor. You might have to share a room with somebody. Oh, that's just what I want when I go to the hospital. I just want to share my room. And I know people already share rooms, but if you go to a good hospital, you don't have to necessarily share a room. And who wants to share a room with the person anyways? What happens if the person is having a reaction to their medication, or is in writhing pain, or is just a terrible person to share a room with? You're in a hospital. This is supposed to be, modern, personalized, private care. What are we doing, having healthcare, like poor tenement immigrants in the early 1900s, where we're all just sharing rooms, like Charlie in the Chocolate Factory. And then you don't get to pick your doctor? I mean, that's kind of an important thing. That's kind of an important luxury people have nowadays, where even under shitty Obamacare, at least they give you a list of doctors to choose from. You can't choose your care. That's not something you just blow over. That's kind of a big deal. And everybody just loves their healthcare. What do you even mean by that? How do you quantify everybody just loves their healthcare? See, this is my problem when people say things like that we need to have healthcare like the rest of the industrialized world because everybody in these other countries love their healthcare. But again, if you actually dig into the data, not everybody loves their healthcare. In fact, in a place like Australia, most people don't love their healthcare.
I don't go to see the doctor very often. Obviously, I want to be able to be there, him or her to be there when I need him, but I don't go and see the doctor very often. Other people may have other needs. They need to go and see the doctor more often. This is what allows us to keep those prices down, keep the costs down for everyone, while also taking a very clear focus on preventive care. I think too often we talk about the healthcare system and the rising cost of healthcare in a one-dimensional way without actually focusing on what it would look like to have a healthcare system that promotes prevention and health and well-being.
Yeah, that Medicare for All will happen before that happens. I'll tell you that. You think you're going to beat big sugar and fast food and junk?
I think we just start with information.
Mm-hmm.
See, what I love about that exchange right there is you can kind of see the whole reason why Tulsi wants to get out of this Medicare for All business to begin with. I really believe she only is doing this kind of Medicare for all, but not for all thing. Medicare for all who want Medicare for all, but Medicare for some and then private insurance for something, is because she doesn't believe in the Medicare for all narrative. That's the thing I've always thought about Tulsi. She's a little different from the other Democrats, and she's only saying this so that she can get the Democratic vote. But you can tell exactly what she said. That's what I say all the time. I don't go to the doctor, and I don't want to have to pay for other people who I've never met in my life, who have completely different lifestyles, and who might have, lifestyles detrimental to their health that's actually keeping them sick in the first place. I don't have to pay for that person. And you could tell right there, I think Tulsi kind of feels the same way. I think Tulsi is kind of in this boat of like, look, I don't go to the doctor and people go to the doctor more than me. But what we should do is teach prevention so that all these people who need to go to the doctor all the time don't have to go to the doctor all the time. And here's the mindset of progressives. Like, no, what are you, crazy, Tulsi? Yeah, good luck beating big sugar and, big pharma and big fast food. Good luck getting people to stop their habits that keep them sick in the first place. Just make sure everybody pays.
You think you're going to beat big sugar and fast food and junk?
I think we just start with information.
Mm-hmm.
Just make sure everybody pays the big government to pay for everybody's health care. So if you go, one time a year to the doctor, you still pay the same amount that somebody who goes to the doctor 10 times a year pays, because that's just how a fair system works, right? I don't go to the movies very often, but I still got to pay the same amount every year for a movie credit that somebody who goes to the movies 10 times a year goes. You go see more movies than me. I don't see any movies, yet you get to pay the same amount that I do for the movies. Where is the fairness in this? This is what we're talking about. This is why Medicare for All is such a terrible idea. Because it penalizes you for actually doing the right thing. It penalizes you for not needing to go to the doctor.
I think we just start with information.
Mm-hmm.
I think there's a lot of, I think we start with informing people about, even just the simple things like putting the calorie and nutritional content up on different menus. I don't know about you, it makes me look twice for okay, maybe I want to choose this over that. And number two, dealing with the food deserts that we have in this country in a lot of urban cities, a lot of communities of color, communities of poverty, where they don't have choices. So you can give people information, but if they don't have the option that they can either afford or walk down the street. We were in Detroit not long ago, and we were visiting with some urban farmers there. And they just talked about in their neighborhood, the liquor store was the only place that they could go to get their milk or their bread or the
Right.
groceries that they needed. So there's no Whole Foods, there's no local like farmers market going on there. And this is something those people were trying to fix. They're growing food. They're turning vacant lots into urban gardens, teaching people how to grow food, how to cook healthy food. These kinds of things are happening in communities across the country. I think we got to place a greater emphasis on that, both information and access to quality, healthy food.
Tulsi is actually saying something really important right there, which is she's trying to understand the root cause of why people need to go to the doctor in the first place. They need to go to the doctor because we have a huge percentage of the country who have no idea how to eat right and have no access to actual good, nutrition-dense food. And what she's trying to address is the fact that, there's neighborhoods where people have to go to their liquor store to go grocery shopping. And there's, in the middle of the country, food deserts where all you get, no matter where you go, it's McDonald's, Burger King, Olive Garden is probably the healthiest choice. Cheesecake Factory is the healthiest choice. You got to get a salad at the Cheesecake Factory to actually make a healthy choice, right? She's talking about the fact that we don't grow food right, that we need people to fucking put farms on top of their buildings and build urban gardens and grow food with compost on their windowsills in apartment buildings, urban farming, because this is the only way people can get healthy food.
But you still are a firm supporter of Medicare for All. You just have a little bit, and it's not. So the problem, it used to be if people kept private insurance, was that some people could opt out. You can't have that.
Yeah.
Everybody has to pay in.
Yeah.
That's how it works.
Right.
And just like every progressive I see address this issue, it's like, no. We just need money. We just need people to spend more money. And so Medicare for all. Medicare for all, for all, for all. Everybody, no matter who you are, no matter what you eat, doesn't matter. If you're a fat ass, if you're a skinny ass, if you take care of yourself or you sit on the couch and smoke weed, watch Netflix and eat Cheetos all day, you get to pay the same amount as the guy who's eating right and goes to the gym every day and takes the right supplements. Just keep paying. That's all it is. Medicare for all, Medicare for all. And this is why I'm starting to like Tulsi now. Even though I wish she would just get away altogether from this Medicare for all thing and just, do the thing she knows is right, which is get the government out of healthcare. She has to toe the Democrat line because, people like Jimmy and his audience, which is pretty massive, and this whole progressive side, this whole Bernie side is starting to warm up to her. So she needs to win them over. So she's trying to kind of play this, middle of the field thing, but she just needs to go for it. Come on, Tulsi. Let go of the Medicare for all. You know it's bullshit. You know that you don't go to the doctor and you don't want to pay for other people to go to the doctor because you know it's a racket. And the last thing I want to show you here is later on in the episode, Tulsi had to leave, but Jimmy's kind of going through where he's talking about, he's kind of trying to sum up his exchange with Tulsi and what Tulsi wants, because I think even he knows the exchange was a little awkward because for the first time ever in the history of Tulsi running for president, Jimmy started to kind of push back a little bit against a part of her agenda, which he never does. And he doesn't like the fact that she believes in Medicare for all, kind of, but still private insurance. And so let's watch this real quick.
The idea of everybody getting the same Medicare for all, the beauty of that is if the powerful people in the culture and the rich people in the culture have the same experience when they go to the hospital or get the health care as poor and working people, then they'll make sure it's running properly. That's the idea.
So Jimmy reveals a lot about his thinking and about the way progressive see this whole thing, which I find interesting because I didn't know this was what the idea was, which is if we get the rich people and if we get healthy people to pay for the insurance and to pay for the healthcare that they're not using, that it's the sick, most likely poor people that are using most of, that they'll start going to the shitty hospitals and the rich people will now force the hospitals to be better. And it's an interesting concept, yet it's never been proven to actually work. And what will most likely happen, which is what happened in communism, in any example that you can find, is that the rich people will still win because they'll bribe doctors. They'll find ways to pay for the better service. They'll pay more for the better service, and then if nothing else, what they'll start doing is they'll start moving their money out of the country so they don't have to pay the taxes in the first place. They'll find all the little tax loopholes so they can get their money offshore, still live in the US, still use the healthcare, but then use the money they have to bribe doctors to get the better service. They're not going to pay to use the same service of some 2-star hospital in Elmhurst, Queens, New York. They're going to still go to Mass General. They're still going to go to, the NYU hospital. They're going to go to the best hospitals in the country. They're not going to go where the poor people go and effectively try to change it and make it better. What they're going to do is they're going to use the money they have to find ways to pay doctors who are going to want to take that money, because once you start socializing the healthcare system, doctors are going to make substantially less than they do now with still the same medical bills they needed, and they're going to take the money from the wealthier people, because why else would you be a doctor other than to make money? Who wants to work 28-hour days, 36-hour days, 48-hour days, nonstop, no sleep, jumping from surgery to surgery, seeing exponentially more people per day because now everybody has healthcare, and not be financially rewarded for it? So I'd love to know what you guys think. It's a very interesting concept, Medicare for All, and debating it on this side, because I understand most people, a lot of people in this country want it because they don't understand what it really is and what really comes with it. So I'm here to help you understand the other side of it. Whether you agree with me or not, let me know down in the comments what you think. Do you agree? Do you see the points I'm making? Or do you totally disagree? Do you think this is all bullshit? I would love to know what you think. Also, please subscribe to the channel, give me a big thumbs up, and I'll catch you on the next one. Peace.